good evening, everyone. Thank you for being here on this day. Shall we begin, sir?
Yeah, please.
Yeah, thank you. Thank you, everyone, for spending your time and coming over on this event today. Today is a great day, wherein two greats are collaborating over here. I would like to start with a quick introduction from both the teams, essentially the key members, and then we'll take the event forward. From Apollo Hospital side, we have our Joint Managing Director, Dr. Sangeeta Reddy from Apollo Hospitals Group. Thank you, ma'am. Thank you for coming on board. We have our Group Medical Director, Dr. Anupam Sibal. So, thank you for coming on board on this, event. We have Mr. Anthony Jacob, who is the Chief Executive Officer of Apollo 24/7. Thank you, sir. And I have with me Dr. Lalit. I'm the Principal Medical Officer from 24/7. And with me, I have my team members, Jasmine and Dr. Umar, who support me in this program. Thank you, everyone. Thank you for spending your time and coming on board. From Cleveland side, the clinic, by the Cleveland Clinic, we have Mr. Frank, who is the Chief Executive Officer of the clinic by the Cleveland Clinics. We have Mr. Nikhil, who is the Chief of... We have Mr. Egbert, who is the Executive Vice Chairman from the clinic by the Cleveland Clinic. Thank you all. Thank you and spending your time. We have Justin Poole, who is also supporting our program and managing all the operations over here. I'm sure I have not missed any key members over here. If there is, please spare me. Thank you, everyone. And that was a quick introduction. I would like to hand it over and ask Dr. Anupam Sibal to please incite us on and give us the opening remarks. Thank you, sir.
Thank you very much. Good morning to our colleagues in Cleveland. Good evening to friends in India. I'd like to thank our friends from both the electronic and print media for joining in. Thank you very much. We know how busy you are and appreciate you taking out time. You see, medicine's become very complex. If we look at the scenario today, there are 13,600 diagnoses, there's 6,000 different procedures, 4,000 different surgeries, and the number of procedures, the number of surgeries keeps increasing. We are diagnosing more and more conditions that were not clearly defined are now being clearly defined because of genetics and our advances in diagnostics. And we are also learning newer ways to perform procedures, newer ways to perform surgery. So medicine is very complex and is becoming increasingly complex. But just to give you another data point, if we look at the kind of evidence that we have out there on PubMed Central, where all peer-reviewed papers are essentially housed. So if you look at 2020, there were 289,537 papers that were published. That works out to roughly 793 papers per day. And that, believe it or not, is as many as 33 papers an hour. So by the time we finish this press briefing, there would be 16 papers that would have got published. And I'm talking about peer-reviewed papers. But let's look at diabetes, which is a very common condition that all of us are familiar with. There are more than 450,000 papers on PubMed on diabetes. And in 2019, before the COVID pandemic struck us, in one calendar year, there were 31,000 papers on diabetes, which works out to 3.5 papers an hour. So this is one condition, and there's that much evidence out there. So what I'm trying to say here is that when it comes to complex problems, we really do need the best specialists to put their minds together. We need them to deliberate, to discuss, to debate, and then make a plan for an individual patient. And that is what we are trying to do through this collaboration with the clinic at Cleveland Clinic. We want a specialist from India, and we are not talking about the family approaching a clinician directly overseas who does not know the clinical details, does not know the family history, does not know how the condition has panned out over weeks, months, years. So we are talking about getting a specialist from within the Apollo system.
Inquiry कर रहे हैं कुछ
Dr. Anupam, I guess can you just tell me?
Yeah, so what I was saying was that what we are trying to do through this collaboration really is to get an expert from within the Apollo ecosystem who knows the family history, who knows the patient, and knows not just this episode, but what's happened before over a period of weeks or months or even years. And then that specialist gets into a discussion with an expert from Cleveland so that we are able to offer the best treatment option. And that's really what we're trying to do. It brings together India's largest integrated healthcare provider, Apollo Hospitals Group, with Cleveland, which is a globally respected international healthcare provider. And I think the two together brings really what is the best today, because what is the best today could change a month later, and that's where the collaboration comes in to make sure that we keep ourselves abreast of what is the latest. With that, I'm going to hand it over back to you, Lalit.
Thank you, sir. Thank you. That was quite insightful, and always, it's been the case. You filled with so much knowledge, so much data, which always excites us, always motivates us, and I think this one collaboration is the result of that hand-holding, you have been doing so far with us. Thanks a lot, sir. I would really request, our joint managing director, Dr. Sangeeta Reddy, to please come us and excite us for this collaboration and how we can take it forward. Thank you, ma'am.
So, namaste, good morning, good afternoon, and good evening to people from all over the world. I think this is a tremendous and very important step in our journey towards enabling universal access to quality high-end healthcare to people all over the world. And I'm extremely excited. Let me begin by thanking our colleagues from the very well-respected institution of the Cleveland Clinic, for my team members, other members of Apollo Hospitals, Anupam Sibal, Dr. Lalit, Anthony, and the technology team behind who've enabled us to have this powerful platform. I also want to remember our chairman, because like I was saying, our journey in telemedicine began in the year 2000. And it was in 2000 when President Bill Clinton was visiting India that we actually requested him to put on the button which connected our high-end super specialty hospitals to a rural environment where we had installed appropriate technology. And so there, a cardiologist from Hyderabad did an echocardiogram or viewed the echocardiogram which was being done in a small village and diagnosed a hole in the heart and discussed the treatment plan for this young child. And this was 22 years ago. The world has changed and evolved. Technology has become ubiquitous. Bandwidths have improved. Capability is enhanced. Linkages, or the Internet of Medical Things, are bringing together medical technology, and artificial intelligence is enhancing the care protocols, enabling and capturing the power of the human intellect or the clinicians and bringing it live. But it is a large and complex world, and ultimately there's so many options being put in front of patients. We at Apollo would like to ensure that we give them the best treatment option modality, and our tie-up with Cleveland Clinic is one critical step towards enabling this world's best option to come to customers in India and across the world. So I want to thank our Cleveland Clinic colleagues. I also want to say one word in terms of the process or the methodology. Let us remember that high-end hospitals are doing a tremendous job within their care environment. If we can put a virtual net around them to extract knowledge, to connect them with their customers, to connect them with global customers, and find a way to bring care, capability, and medical decision-making into the palm of a consumer's hand, that is when we are truly transforming healthcare and enabling it to be closer and closer to the consumer. That's what we're trying to do at 24/7. Today, with over 12 million customers, and I say customers and not patients, interacting in health, in wellness, in teleconsults, in condition management, we are slowly but steadily bringing healthcare closer and closer to the individual with the primary purpose of keeping people healthy, but also when they have significant conditions, ensuring that they have the most appropriate care. So towards that, we announced this tie-up with Cleveland Clinic with the greatest of pleasure. We believe it's one more step in bringing advanced healthcare within the reach of our people. The Apollo network today encompasses more than 10,000 high-end super specialty beds, We also have over 300 clinics, over 4,000 pharmacies, a significant research as well as education program. But the journey is just beginning, or it's a continuous journey towards trying to bring care within the reach of everyone. So let us say that technology and the best of human minds are coming together in the interest of people and humanity to deliver one more level of high-end care. This is yet another step. Thank you very much. Namaste.
Thanks a lot, ma'am. Again, always very insightful to hear from you. What I feel, the torch we take across from the Polo, that's the logo we believe. We want to take it across not only to a domestic thing, we also want to go across the borders to the clinic by the Cleveland Clinic where we are collaborating now and many more to come. Thanks a lot, ma'am. I would really now request Mr. Frank to come up, the CEO of the clinic by the Cleveland Clinic, to come up and share his views. Thank you. Frank, if you can unmute.
Dr. Kanodia, thank you for the introduction. I just want to echo that the Clinic by Cleveland Clinic, we're really pleased to be and delighted to be part of this collaboration. I want to thank Dr. Reddy, Dr. Sabal, as well as Anthony and other leaders across Apollo Hospitals for making this real. A little background, the Clinic by Cleveland Clinic is a collaboration between Cleveland Clinic and Amwell, one of the leading telehealth technology developers and providers across the globe. And it's unique in the fact that it brings a academic medical center as well as a technology company together to basically unlock access to the world's best healthcare. We believe firmly that healthcare, particularly when dealing with complex medical conditions, is a team sport. And the best care for the patient is derived by connecting the best specialists together as well as the best specialists with the patient. Cleveland Clinic has a rich tradition of academic medical leadership, #1 heart institution globally for 27 years, top hospital globally since its founding over 100 years ago. And we're, again, delighted to be collaborating with the Apollo Hospitals and Apollo 24/7. Really, our vision here is to help connect patients dealing with complex medical conditions, whether it's a heart condition, cardiac condition, cancers, or other complex conditions, with one of the 3,500 expert specialists and subspecialists at Cleveland Clinic. We really are excited about the potential for telehealth to help patients facing these complex conditions and really eliminating either geography or time as a constraint in terms of accessing that best expertise. I just want to give an example that was recent. A patient we helped who was a medical student in Sao Paulo, Brazil. This young woman was facing a complex mitral valve condition and really needed to access the best advice to make sure that she was being treated effectively and could actually continue her life and continue her career. She's recovering really well, and we were able to provide significant help in terms of new access points and journeys. I think the final thing is I just want to communicate the value of expert second opinions for these patients. We find over our data, the patient population that we've served so far, about 28% of the time there is a change in diagnosis, about 72% of the time there's a change in the care pathways. And that's getting back to Dr. Sabal's point, it's about making sure that you're keeping up and we're able to access the most cutting edge care and really the most cutting edge information in terms of the care. So again, we're really delighted to be partnering with Apollo Hospitals. We really look forward to connecting the clinicians at Apollo Hospitals with clinicians at Cleveland Clinic and helping Apollo Hospitals patients really get the best care possible. I also want to offer our Executive Vice Chairman, Egbert van Nacht, is actually calling in from Amsterdam, and I think it reflects our vision of a global network. Cleveland Clinic is known for the original campus in Cleveland, but also with locations in Abu Dhabi and coming soon in London. We really are becoming a global network, and tying in with leaders like Apollo Hospitals just makes that even stronger. So Egbert, I'll turn it over to you for a few words.
Well, let me echo everything you said. I'm incredibly inspired by also the vision of Apollo Hospitals. I think there's a tremendous opportunity, and we are indeed just beginning. We are, as a board of the Clinic by Cleveland Clinic, very, very impressed by Apollo and this partnership. So we believe this is of strategic value and not just a project that can actually carry on for many years in the future, all in the interest of people, right? So we are at the clinic, by Cleveland Clinic, very focused on what we call people centricity, patient centricity, to provide the best experience. And we measure that through Net Promoter Score. Our most recent scores are around 60%, which is really a very high level NPS score. And we do that because we believe in the purpose of providing access to the best medical expertise wherever you are in the world, so that nobody is left behind. And I think that's a purpose that is meaningful, aspirational, and we have the technology, also through the MWell platform, to make that possible. The feedback that we are getting from the many thousands of cases that we have handled is extraordinarily positive, and we of course always working to improve that experience every day. But I'm very grateful, and I see a great future for our partnership. Thank you.
Thanks, Frank, and then thanks, Egbert. So we have heard from our leaders the announcement of this partnership with the Apollo Hospitals Group and the Clinic by the Cleveland Clinic. Herein, I would like to open this forum for the Q&A and interaction with the media. I would really request our media partners and media people to come on one by one and ask their specific queries if there is any, and we'll definitely put the answers.
करो ना, लेकिन मैं अपना दूसरा काम करके मेरे को स्टेशन जाना है, तो उसे हमारा काम हो जाता है.
We request people to please keep on mute, and